The World Health Organization has released its report on the origins of the COVID-19 pandemic in China. According to the report, it is unlikely that the virus was leaked. However, the Director General Tedros Ghebreyesus says the report is inconclusive and requires extensive investigation and access to data. We will get to know more about the joint report by the World Health Organization and the Chinese authorities. I am Holasunbo Modupe. Welcome to Sound Health. The program continues shortly with COVID-19 updates.
More than 100 economies have received life-saving COVID-19 vaccines from COVAX, the global mechanism for equitable access to COVID-19 vaccines. The milestone comes 42 days after the first COVAX doses were shipped and delivered internationally to Ghana on 24 February 2021. COVAX has now delivered more than 38 million doses across 6 continents, supplied by 3 manufacturers: AstraZeneca, Pfizer BioNTech, and the Serum Institute of India. Of the over 100 economies reached, 61 are among the 92 lower-income economies receiving vaccines funded through the Gavi COVAX Advanced Market Commitment. The WHO says despite reduced supply availability in March and April, the result of vaccine manufacturers scaling and optimizing their production processes in the early phase of the rollout, as well as increased demand for COVID-19 vaccines in India. COVAX expects to deliver doses to all participating economies that have requested vaccines in the first half of the year. According to its latest supply forecast, COVAX expects to deliver at least 2 billion doses of vaccines in 2021. In order to reach this goal, the COVAX facility will continue to diversify its portfolio further and will announce new agreements with vaccine manufacturers in due course. The Lagos State government has further eased restrictions on social and event centers across the state. Governor Babajide Sanwo-Olu said after due consultation and deliberations with relevant stakeholders and MDAs, all event centers must hold a valid license of the Lagos State Ministry of Tourism, Arts and Culture prior to operating as an event center in the state. Also, all event centers must be duly registered and verified on the Lagos State Safety Commission website www.lagsafetyreg.com prior to holding any event. According to the guidelines, an event safety clearance must be obtained from the Lagos State Safety Commission through the website for any proposed event or exhibition. Safety marshals shall be deployed by an accredited event safety consultant from Lagos State Safety Commission for every social event with attendance exceeding over 200 people. In addition, occupancy limit at any event must not exceed 50% of the maximum design capacity of the hall, wherein occupancy limit stickers provided by the Lagos State Safety Commission must be boldly pasted at the entrance of the event hall. Maximum allowable capacity for event centers, irrespective of occupancy limit, is 500 people. An event duration should not exceed a maximum of 6 hours. Physical distancing shall be maintained between seated guests, and a maximum number of seated guests should be 6 people on a table of 10 persons. Any violation of this protocol shall attract fines and penalties in line with the Lagos State Infectious Diseases Control Regulation 2020. Over 163,000 confirmed cases and 2,060 deaths have been recorded in Nigeria. More than 1 million persons have been vaccinated. Globally, more than 7 million confirmed cases, including above 2 million deaths, have been reported to the WHO. A total of 780 million vaccine doses have been administered.
Now, Dr. Abi Abraham will highlight the findings of the joint investigation by the World Health Organization and the Chinese authorities. She's a consultant public health physician. Thanks for joining us.
Thank you so much, Modupe. I really appreciate this. It's great to be there with you.
It's a pleasure to have you on the show. According to a draft copy of a joint WHO-China report on the origins of the COVID-19 pandemic, the new coronavirus was most likely transmitted from bats to humans through another mammal species. What is your assessment of the report? Is it comprehensive enough?
Well, there was a 120-page report, wasn't there, that the whole world saw about a week ago or so. It was pretty comprehensive. Just to talk a little bit about the origins, it was in May 2020 that the World Health Assembly requested the Director General of the WHO to continue to work very closely with the World Organization for Animal Health and the Food and Agriculture Organization and countries as part of the One Health approach to identify the zoonotic source of the virus and the route of introduction to the human population. By zoonotic, I mean, the animal source of the virus. And just to identify the source of it, to prevent both reinfection with the virus in animals and humans, and also the establishment of new reservoirs. Why did they want to do this? Because they wanted to reduce further risk of the emergence and transmission of the zoonotic diseases. And so they got all these 34 officials. 17 of them were from China, and another 17 were from several countries of the world. They came together in May. They were working online, and they worked very, very hard. It was a multidisciplinary team of experts, and from July, they really started to look into the cause of all the of the COVID. They really looked deep into Wuhan. They looked into the few first cases who were there. They interviewed them. They went to all these so-called animal reservoirs. They took a lot of reports. And as you know, in January, this whole team, they went to Wuhan itself and they went to the wet Wuhan place and all. They did a lot of interviews. And yes, there was a very comprehensive report. But as to how helpful the report is really the issue, isn't it?
Yes.
The issue is it a helpful report? I am not, well, to be frank, it isn't really very helpful. It has shown us a little bit of things, but it hasn't shown us that much. Because, like you rightly said, there were 4 likely sources of the novel coronavirus. And the first source was the intermediate host. And that is a spillover from what they felt was that there was a possibility that the virus came from an animal, possibly a bat or a pangolin, which is a mammal. It came from that bat or pangolin. It jumped onto or was spread to a likely animal that humans deal with. That is like a farm animal, and somehow it came to human beings. That's the first source. The second one is for it to happen directly. That is, could it happen directly from these bats and straight to human beings? The third one was through a cold food chain, because they have seen that actually the virus can spread through cold food. And the fourth one, like you know, is the most controversial. Was it introduced? Was the introduction resulting from a laboratory incident, accident, or deliberate mishap? And that is it, really. This is really the 4 things. And they're saying it is most likely from an intermediate host, but there's still no proof. Even after almost 1 year of investigations, there's no proof as to where this virus came from. There's really no proof. They're just saying it is likely, it is possible, but there's nothing solid has been done by this incredible team.
All right, Dr. Abraham, let me ask you this question. Now, from your response, how sure are we about this pathway?
That's a great question, because I think we learned something in medical school, and we learned it obviously. If you're a doctor, if you're in the medical profession at all, you will know about what is called zoonosis And zoonosis is infections that are spread from animals to humans. And without a shade of doubt, 3/4 of infectious diseases at the moment are spread from humans, from animals to humans. Let us just go as low as the mosquito. Think about the mosquito, the tick, viruses like that, parasites like that. Then we look at, the previous 7 massive infections that we had, the yellow fever, the MERS, the previous SARS COVID that we had in 2003, Lyme disease, and all these diseases are actually spread by animals. So it is really right, it is very possible that the SARS-CoV-19 spread from a human, actually spread from an animal. That is possible. The second thing is that did it spread directly from an animal or did it spread indirectly from the animal? All those things are also possible. The third thing is that could it have spread via frozen food? That is possible. That can happen because we know viruses, bacteria, and parasites actually spread through frozen food. Number 4, could it have spread through a lab leak? That is also possible. Even within the Wuhan itself, the Institute of Virology, they did say that they had been studying the SARS-CoV virus. They admitted to that they had been studying it. And it is true that there can be a lab leak from scientific evidence or from scientific precedents. But as to what caused this one in particular, the jury is still out.
There is also a finding that the strain was not found in bats in China, but in minks. What do you make of this?
That the strain was not found
in bats in China, but they were found in minks and cats. What do you make of this?
Again, there is nothing conclusive. The strain, there was a strain that was found in a bat. But there was actually a strain of SARS-CoV-19 that was found in a bat. But the genomic, that is the sequence of that strain, was not compatible with the strain that was affecting human beings. And so this is why they are still wondering whether this is possible or not, because there's an evolutionary divide. What the scientists are saying is that for that strain that they found in the bat, it will take several years for it to evolve into the type of SARS-CoV-19 we know about that affect human beings. Now, just to let you know something, which you probably know, there are lots of diseases that animals carry. A lot of animals, including dogs, snakes, cats, and lots of domestic animals, they carry disease. And they carry viruses and bacteria and parasites that do not affect them, but affect humans. Now, this virus, the SARS-CoV-19, was found in a bat, but it wasn't the exact genomic sequence that has been seen in human beings. And so because of that, there's still the shadow of doubt, casting a shadow of doubt. It was really not also found in the mink. Again, it was the genomic, the sequencing. Some of the sequences were not very compatible with those in humans. And so this is why, like I say, it is still really a little difficult to ascertain exactly where the COVID-19 virus came from.
The WHO attributed the inconclusiveness to limited access to data and samples. Although it was a joint investigation, countries are questioning the transparency of the Chinese authorities at this time.
Absolutely. I think it is very, very clear. Even the Director General of the WHO, spoke clearly about it. And he said, there really wasn't enough access to data. And a lot of the studies that were done by the Chinese, he said it in his speech, were not, in a sense, made freely available to the 34 man delegation that came to study the origins of the COVID virus. it is clear there was some withholding of information. I don't even think that is a theory or a hypothesis. I think that is fair. Because for the Director General of the WHO to come out and say it openly means that there needs to be a lot more work done by the Chinese authorities in terms of transparency, accessibility, and openness to the study of this virus, so that we can get to the bottom of it and prevent further pandemics and epidemics.
Do you think this scenario will be a repeat of what transpired during the 2002 and 2003 SARS outbreak, where after months of investigation, there was no scientific conclusion?
Well, again, science is not really a very exact science. It's exact discipline. Because, and again, the viruses behave according to how they want to behave. There are certain schools of thought that say that it takes a very long time to get to the direct origin of the virus anyway. So what are we talking about? 1 year is too small. And I think that was exactly what happened with the 2003 SARS epidemic. It was perhaps that time was short to get to the source of the virus. And further studies really need to be done. It's a lot of work in terms of matching the sequences, doing a lot of lab studies, interviewing the patients. Sometimes you even have to go to the pharmacies and find out, how many people got cough syrups. If it's a respiratory virus, how many people got antibiotics and stuff like that. You have to go to the hospitals. You got to swipe the doorposts, swipe the surfaces. There's a lot of work actually that has to be done. So in fairness, I don't think we should just throw away the baby with the bathwater. I think genuinely there definitely needs to be work done on this, and hopefully it wouldn't be a repeat of what happened.
Okay, what does this portend for the emergency response in the future? Because events are already unfolding as a result of this development. US and China have already declined signing the International Pandemic Treaty.
Well, I think there are always many people at the table. There are always many stakeholders. There are always conflicting thoughts and conflicting agendas. And like I say, yes, it's not going to. It will be tough. It's going to be difficult, especially because lots of countries were really looking forward to, coming to terms with what really caused this. There's now a high level of suspicion and a high index of suspicion as to really what caused it. Unfortunately, COVID-19 is becoming a political problem as opposed to just a health problem. So I should really suggest that with the WHO, what they could do is to really also open up a whole new set of investigations, and also work very closely with the Chinese government to ensure that there's maximum transparency and there's also maximum accountability. I think this is absolutely critical, because we don't want it to become a political game. The lives are being lost here. Lives are being maimed. Lives are being, there's a lot of problem in the world. And so we really don't want this to sink to a political problem. We really need to get it together. And so that is my own advice to the WHO, that they really need to come to terms with, really what caused this, and start to sort out further investigations.
We appreciate your resources on the program. We hope you will oblige us again, Dr. Abraham.
Thank you. Thank you very much.
I have been speaking with Dr. Abi Abraham on the origin of the COVID-19 pandemic. Dr. Abi Abraham is a consultant public health physician. Sound Health continues with trending health reports. This is where we wrap up this week's edition of Sound Health. Remember, you have all it takes to flatten the COVID-19 curve. Get vaccinated at any of the health centers. You also need to carry on with all precautionary measures even after receiving the vaccine. A sound health is a sound mind. Make healthy living your choice.